Lung cancer remains the leading cause of cancer-related deaths in the United States, and despite advances in treatment, it continues to pose a significant threat. Today, we are joined by thoracic surgeon Jonathan Valina Vargas and lung cancer survivor Lisa Goldman with more on a new therapy, a groundbreaking advancement in lung cancer management. Thank you both for coming on today.
Thanks for having us.
Thank you.
So doctor, what is adjuvant therapy and why does it provide hope for lung cancer patients?
So adjuvant therapy is basically two new types of treatment that are given after surgery, sometimes before, but usually along with surgery to prevent cancers from coming back. And that has really changed how we treat lung cancer in the last few years.
And what is the difference between neoadjuvant and peri-adjuvant therapy?
So neoadjuvant is when we give the treatment before surgery in order to shrink the tumor and may make the surgery easier. And perioperative means you give before and after surgery. And really the concept of both of these therapies are to prevent the cancers from coming back after they've been surgically removed.
So Lisa, tell us about your story.
So I'm really fortunate to be able to share with you that I have been living with stage 4 lung cancer since 2014, so over a decade now. I was diagnosed initially when I was 41 years old, and I had no risk factors, no history of smoking, no family history, no known exposures to carcinogens, so it was quite a shock, but I've been doing really well. I started with chemotherapy, and when that stopped working, I was able to switch to something called a targeted therapy for my specific type of cancer.
And so this therapy wasn't an option back when you were diagnosed, but if you had the option knowing what you know now, would you consider it?
Absolutely. So there have been so many advances in treatments and options for lung cancer patients in the last 5 years. And if the doctor proposed adjuvant therapy for me today, that would be something that I would be very enthusiastic in pursuing.
And doctor, this therapy, is it appropriate for all cancer patients?
With the advancements that we've made, this therapy is actually now appropriate for every single stage. That has to be directed by a doctor, though. So if you have the diagnosis of lung cancer, you should speak with your doctor about you being a candidate for some type of adjuvant therapy.
And Lisa, how important is lung cancer research to you?
Lung cancer research means everything to me. When I was diagnosed, I was given basically 9 months to live, and my children were in elementary school, and nobody even expected me to live to see them graduate from elementary school. But just last week, I dropped my youngest child off at college and helped her move into her first dorm room. Research made that possible. The medication that I've been on for almost a decade wasn't even available or FDA approved when I was first diagnosed. So research has basically saved my life and given me a ton of hope.
Well, your story is so inspiring, especially since you had no risk factors way back then. So to see the improvements and to see all the research come through is really, really inspiring. So if people are interested in maybe learning more about this new therapy or just to learn more, where can they go?
To learn more about resources for lung cancer, go to lcfamerica.org.
All right, thank you both so much.
Thank you.
Thank you.